Hi, my name is tunde-sanya. The topic of my presentation is dehydration in the elderly, causes, effects, and prevention. What is dehydration? Dehydration occurs when there is more fluids lost than taken in. The body does not have enough water or fluids to carry out its normal functions. Percentage of water in the human body. Water is of major importance to all living things. Up to 60% of the human adult's body is water. Babies have the most. At birth, about 78%, and by a year old, 65. The adult male has about 60% of their body made up of water. The adult female has more fat makeup than the male. They have about 55% of their body made of water. The percentage of fluids is significantly reduced in the elderly due to aging and increase in fat content in the body. The elderly population. Most countries have accepted the chronological age of 65 years as a definition for elderly or older person. The young old are grouped as 65 to 75 years old, the old as 75 and above. According to CDC.gov, by 2050, it is anticipated that Americans aged 65 and older will number nearly 89 million. Statistics of elderly dehydration and the economic impact. According to the Hopkins 2005 audits of trauma centers and emergency rooms revealed that 30% of older people came in with a dehydration related illness. Statistics of elderly dehydration and economic impact. According to Seal et al. 2004, the economic burden associated with avoidable hospitalization due to dehydration in the elderly patient was substantial. The article states that in 1999, the potential national savings from avoidable hospitalization in these patients could have been as much as $1.14 billion. The Burdens and Outcomes 1991 states that 6.7%, that is 731,695 of Medicare hospitalization had dehydration listed as one of the five reported diagnoses, a rate of 236.2 in a 10,000 elderly Medicare beneficiaries. The article also goes further, stating Medicare reimbursed over 446 million of for hospitalization with dehydration as the primary diagnosis. The article concludes that about 50% of elderly Medicare beneficiaries hospitalized with dehydration died within a year of admission. These statistics paint a worrisome picture because dehydration is very preventable. Causes of dehydration in the elderly may be due to the following: increase in chronic diseases such as arthritis, decrease in mobility, inability to voice the need for more fluid intake, which may be due to dementia, neglect, which can mostly occur in long term care facilities or even in private homes, need to reduce urination due mainly to limitations in mobility. Early signs of dehydration in the elderly: dry skin and sticky tongue, thirst, poor skin turgor and dry skin, decreased urination, and urine output. Severe signs and symptoms of dehydration. They include confusion and irritability, sunken eyes, low blood pressure, rapid breathing, delirium. Complication from dehydration. Urinary tract infection is one of the common complications of dehydration in the elderly. It presents first as confusion and, in some cases, bloody urine. This leads to high rates of hospitalization in this population. UTIs can also lead to other diseases when the elderly are hospitalized, such as pneumonia, which is due to decreased mobility, or other forms of nosocomial infection while in the hospital. Other complications include seizures. Elderly dehydration leads to involuntary muscle contractions and loss of consciousness. Kidney failure. Elderly dehydration may reduce blood flow to the kidney, decreasing its effectiveness and functioning. Coma or death. The end result of severe elderly dehydration is death. Prevention of dehydration in the elderly. Education is the most important way of preventing dehydration in the elderly. Proper physical and psychosocial assessment are also important. Economic assessment. Physical assessment. These include the following: nutritional assessment. Are these individuals able to swallow? Is there need for thickened water or any other underlying problems? Also, are dentures properly fitted? Because fluid is also obtained from food intake. Mobility. Do these individuals need help getting fluids due to inability to move or decreased movement? Ophthalmic assessment. Can they see? Or is there a need for glasses? Economic assessment. Do they have funds for getting food, juices, or also water supply? Do they need assistance with getting these supplies? Many of the elderly are on retirement budgets and use a big chunk of their income on medication, leaving very little for anything else. They might need food stamps or connections with programs such as Meals on Wheels. Neurological assessment. Cognitive impairment need for proper neurological assessment that will help diagnose dementia, Alzheimer's, or depression. All this can contribute to dehydration in this population. Education is key to preventing dehydration. Since a good portion of the elderly live in long-term care facilities, educating the caregivers in these facilities and also caregivers at home is of great importance to the prevention of dehydration. Educational goals and objectives. Objectives will be developed to educate adequately. These teachings are grouped into cognitive, affective, and psychomotor domain. Cognitive domain. After teaching, the individuals will be able to state importance of proper hydration. Effective domain. After teaching, the elderly and their caregivers will know how much water to consume in a day. Psychomotor domain. After teaching, the elderly and their caregivers will be able to list ways to increase fluid intake. Ways to increase hydration. Some tips on how to increase fluid intake includes having a cup or bottle water around the house in close proximity to the individual, adding flavor to water, or having healthy juices around. Conclusion: water is key to a good and healthy living. This is even more important in the elderly. Adequate hydration can prevent illnesses and reduce unnecessary hospitalization. Thank you for listening.